Thank you. Thank you for joining this virtual briefing titled Childcare and Peril, How COVID-19 is Pushing this Essential Sector to the Brink of Collapse, held by the Committee on Education and Labor. I hope you and your loved ones are healthy and doing well. I want to remind everyone that this briefing is a public-facing event. A recording of the audio and video of this briefing will be made available to the press and the public shortly after it concludes. I want to note that we invited our minority colleagues to the briefing, but we were informed that they do not intend to participate. However, the briefing is still open to all committee members, and we continue to invite all of our colleagues to participate today. This is not an official committee activity, so there will be no official record of this event, but any member who wishes to share any relevant statement, article, letter, or other item may do so by way of their personal office's communications methods. I also want to remind members to please keep their microphones muted and video cameras turned off unless you're speaking, as usual, and anyone experiencing difficulties should contact our IT staff. To save time, we're going to skip the roll call, but if people could indicate their presence in the chat function, you'll be given an opportunity later to record your presence. But in a moment, we'll hear from our distinguished experts, and our experts, when they finish their presentations, the floor will be open to members to ask questions. Instead of recognizing members in order of seniority, I'll recognize members in order in which they seek recognition by indicating they have a question in the chat box, and anyone in the last briefing who was not recognized that had indicated a desire to ask a question, if you'll say that you did not get recognized in the last, you'll be given priority in this briefing. Members who are using a telephone with audio only should have a member of their staff indicate their interest in the chat box on their behalf. And again, I wish to ask, if you ask a question, please say so in the chat box. I'll have a staff indicate for you. This briefing will last just 1 hour, and we're pleased to have experts on hand who've made themselves available to discuss this issue with us. Members are asked to please ask the questions, and if you could keep it less than 5 minutes, that would be helpful, because if with all the members on the committee, we may not be able to get through all of the members. A chime will sound as a reminder that your time has expired. I'll now recognize myself for a brief opening comment and to introduce the experts. The COVID-19 pandemic has significantly strained the lives and livelihoods of families in many different ways. Working parents are facing the prospect of job loss or furloughs, jeopardizing health coverage and uncertainty about their future. On top of that, there's a child care crisis. Child care providers operate on a very thin margin of high balance with high labor costs and affordability to families. Unfortunately, temporary closures have become the norm, leaving many providers with little revenue, if any. Initial surveys indicate that at least 1/2 of all child care providers have temporarily closed. At the peak of the crisis, 21 states closed child care for all students, but those of essential workers. Rhode Island closed down all child care. As a result, the affordable child care options have eroded all over the country. Center for American Progress estimates that as many as 4.5 million child care slots could be permanently lost unless we come up with significant support. At the same time, child care providers who are serving children of essential workers are incurring increased costs as they purchase personal protective equipment and implement necessary new practices, such as limiting classroom sizes. Congress secured urgent relief for child care providers in the CARES Act. However, some states, like Washington and my home state of Virginia, are warning that the $3.5 billion provided for child care in the CARES Act will only last until next month. Access to affordable child care is an essential step to helping children and parents getting parents back to work and successfully reopening our communities, and we cannot ensure that without significant funding. We cannot take this step unless Congress provides federal funding that families and providers need to prevent our child care system from going into total collapse. The HEROES Act, our most recent relief package passed by the House, would put $7 billion into child care, which would ensure access for essential workers and provide financial support for child care providers. Later this week, we'll introduce a bill, along with colleagues on the Appropriations Committee, that will establish a stabilization fund that will help child care providers stay afloat through the pandemic and beyond. Now, I want to recognize Hannah Matthews and Mary De La Rosa, who are joining us today to discuss how Congress can help child care providers survive so that, in turn, they may help our workers and families get through this crisis. Ms. Matthews is Deputy Director for Policy, Deputy Executive Director for Policy at the Center for Law and Social Policy, or CLASP. She is an expert on federal and state child care policies with a master's degree in public policy and is an advocate for advancing child development, parent well-being, and family economic stability. Mr. De La Rosa is a family child care provider in Los Angeles who runs a high-quality family child care program that serves 14 families and employs 4 child care educators. She has more than 20 years of teaching experience with young children and has a master's degree in educational psychology with an emphasis on early childhood education. I want to thank you both for being with us today. And after your comments, we'll have questions from members. So we'll begin with Ms. Matthews.
Thank you, Chairman Scott. I am honored to speak today about the central importance of childcare and the devastating impacts of the coronavirus pandemic. Childcare is the ultimate essential industry. It helps parents to work, it helps children learn and grow, and it undergirds the economy. Yet years of inadequate public investment have led to a childcare system that was fragile even before the pandemic. Families struggle to afford care, and childcare workers make very low wages. Federal childcare assistance through the Childcare and Development Block Grant is a vital work support for families with low incomes, but reaches only 1 in 6 eligible children. The pandemic has exacerbated these gaps and many more in our childcare system. Childcare has been shuttered nationwide. A survey by the National Association for the Education of Young Children found more than 100,000 providers closed across the country. Those that are open are operating at 50% or less of their usual enrollment. This matters because childcare is primarily financed with parent fees, and childcare providers were already operating on very thin margins before the pandemic. In a March survey, 63% of providers reported that they would be unable to survive a closure of 1 month or less. Hundreds of thousands of programs right now cannot meet fixed costs or pay workers and may be unable to reopen when it's safe to do so. The damage to the sector is already severe. 330,000 childcare jobs were lost in April alone, the equivalent of 1/3 of all jobs in the sector. These job losses impact Black and Latinx women most of all. Permanent childcare closures will hurt families and workers and hold back our economic recovery. The supply of care in low-income communities and communities of color was already lacking before the pandemic and is likely to be hardest hit. This will have devastating consequences for parents who need to work and their children who will be left with no safe options as states reopen. Congress took a critical first step in supporting childcare through the CARES Act. This did allow states to continue payments to some childcare providers and to support the increased operating costs of childcare for essential workers. But the investment to date falls far short of meeting the need. CLASP's analysis estimates the monthly costs of covering the most urgent needs for childcare at nearly $10 billion. Funding in the HEROES Act would be an important down payment to address the growing childcare crisis, but that investment, too, will not save the childcare sector from collapse. A $50 billion investment would begin to address urgent funding needs. Childcare needs dedicated funding to keep childcare providers afloat, to ensure childcare is available for essential workers on the front lines of this public health crisis, and to provide resources to enable childcare to reopen safely. We must treat childcare like the public good that it is and build a stronger foundation for the future. Thank you so much for having me today, and I do look forward to your questions.
Thank you. And Ms. De La Rosa.
Yes. Thank you, Chairman Scott. I'm honored to speak to the committee about the challenges facing childcare today. I run an in-home large family childcare program in Westchester, California. Before March of this year, my program served an ethnically and socioeconomically diverse group of 14 children. I have been an early childhood educator for 20 years, and I opened Creative Explorers 5 years ago. I was able to hire 3 additional teachers to support our quality program. And we were at the end of a 3-year-long process of obtaining permits and approval to expand our program to serve 24 children. Each space in our community is so highly coveted, with most programs having long wait lists. This pandemic has disrupted everything we have worked so hard to build. When Los Angeles public schools closed, we briefly considered remaining open to serve our families. But we experienced such significant issues. Lack of clear guidance on what staying open would look like, obtaining cleaning supplies, materials, and food was virtually impossible. So we made the incredibly heartbreaking decision to close. 2 of my co-teachers, including myself, have our own elementary school-aged children we are now having to homeschool. Since our closure, I have unfortunately had to furlough my teachers. Some are currently receiving unemployment. I applied for the Paycheck Protection Program in March, but we have yet to receive an approval. The future is unclear and uncertain, and frankly, we're terrified. As an in-home program, we do not have the space to accommodate social distancing rules, even though I believe it's important to have them in order to keep our children, families, and staff safe. If I were to accommodate the new health and safety rules, I would only be able to care for 3 children instead of my regular 14, cutting our capacity by nearly 80%. And there's no way any business would survive financially on that income, at least not without additional public support. As Ms. Matthews said, childcare is primarily financed with parent fees. 4 of our families use childcare subsidy, but the others pay out of pocket. We have not collected any tuition fees since our closure in March. We have spoken to each of our families, and of the 14, only 2 said they felt comfortable sending their children back to childcare. The rest, understandably so, unsure and scared to return to a group situation. Many childcare programs operate alone. We do not receive public support, additional funding, materials to help us open back up safely. We will have no choice but to remain closed. To say we are essential is an understatement. We are a lifeline to these families. Please, I urge you to support us, save childcare programs like mine. I have spoken to many early childhood centers in our community, and they too share similar stories. On behalf of all of us, I thank you for listening to my story, and I look forward to your questions.
Good. Thank you so much for your testimony. Now we'll have questions from members, starting with Ms. Bonamici. Ms. Bonamici? Okay, Mr. Morelli?
Good afternoon. Did you say Mr. Morelli, Mr. Scott?
I did, Joe. How you doing?
I'm well, sir. How are you?
Fine, thank you.
Good. Ms. Matthews and Ms. Della Rosa for all your work. I represent Rochester, New York. We have about a 25% reduction in daycare slots over the last 3 months, but some parts of our community are experiencing as much as 75, 80%. In New York, we're in the first phase of so-called reopening, and we may move to our second phase. So first phase was construction, manufacturing, et cetera. But obviously, families who will have workers who go back to work, or those who have essential workers, are struggling without the ability to have their children in quality daycare. This is probably more for Ms. Matthews, but do you have a national estimate on what it would take over a 3-month or 6-month horizon, recognizing that people will be going back to work, so they'll be able to pay for some of the daycare, but a sense for, if you've done a census or have an idea of like a dollar amount of federal support, particularly if we don't provide some additional support for states, and therefore find their support for subsidies being reduced. I know that's certainly an option in New York with a massive hit on our revenues. So that may not be an entirely fair question. But do you have some sense of the magnitude? And I'll mute while I hear your answer. And again, thank you for both for being here this morning, and thank you to Chairman Scott for continuing to have these important briefings.
Well, thank you so much. And as I grew up in Syracuse, New York, thank you also as a fellow former New Yorker. So yes, we have at CLASP, along with our partners at the National Women's Law Center and labor economist Aaron Sojourner, we were able to look at the costs that are needed, and it found that the $50 billion investment that I mentioned would meet childcare needs for a period of about 5 months. What that would include would be meeting both subsidizing the costs of childcare for essential workers. We estimate about 6 million children of essential workers, and that's, of course, paying for that care at higher operating costs. So the premium pay for providers, increased health and safety provisions to keep children and workers safe. That would also include sustaining about 350,000 childcare programs. So as you mentioned, whether childcare programs, the childcare programs that haven't reopened or are at low enrollment, those programs need direct public funding to stay afloat, to be able to reopen when it's safe to do so. We estimate that $50 billion would also maintain jobs for about 1.2 million childcare providers, as well as provide that cost relief for families who aren't able to continue paying their childcare bills, but to make sure that childcare is available when parents return to using it. This is the problem with childcare itself, is that it is reliant on parent fees. And as parents have lost jobs and face lower earnings, that revenue is just not coming to childcare providers. So we do need that public investment to keep providers whole until they can reopen safely and going forward.
Thank you.
Thank you very much. I believe Ms. Bonamici is back.
I am. Can you hear me now?
I can.
Terrific. Well, thank you so much, Chairman Scott, and thank you to our panelists for this critical discussion. We know how important childcare is to our economy, both before the pandemic, during, and of course after. And I was pleased to support the $3.5 billion in CARES and the $7 billion in HEROES, which of course has not yet passed the Senate, but we know that's not enough. My home state of Oregon received $38.5 million from CARES, but they figure it costs about $60 million per month to maintain existing capacity. And I've spoken with parents and providers recently and heard about their struggles, and I really want to thank Ms. De La Rosa for being with us today. We're hearing the same stories here with the lower enrollment and higher operating costs because of cleaning and PPE. And as Ms. De La Rosa said, many cannot even stay open. And we know that if childcare is not available as businesses reopen, parents, mostly mothers, will find it impossible to go to work. And that's why I'm fighting for significant additional funding. And I'm glad, Ms. Matthews, you mentioned the $50 billion. And Ms. Matthews, research suggests that the permanent reduction in childcare slots will result if Congress does not act, and will have costly effects for especially working mothers in particular. And according to the Center for American Progress, the lack of affordable childcare reduces the ability of mothers to work and will expand the gender pay gap. So can you talk a little bit about the effects of the pandemic and what this will mean for, particularly for working women in our economy? And then I do have another question, so I'm going to say that now so you and Ms. De La Rosa can respond. Oregon is, even before the pandemic, a childcare desert, meaning that there's more need than available slots. And we know that childcare workers are often women and people of color, and they're paid near poverty wages, and now oftentimes are expected to have a college degree. So while we work to meet the current needs, what do we need to do going forward? What support do we need? And are there structural changes, like maybe looking at how other countries do that? Are there structural changes that we could implement that would make childcare work for everyone, both the families and for the provider? So I'll start with Ms. Matthews and then both of you on what going forward.
Great, thank you. Thank you for those questions. So turning first to your question around the impact on women. So absolutely, I mean, we are seeing first in the unemployment loss, in the employment numbers, in the job losses, that it is women, including in the childcare sector, but in other sectors as well, who have been the hardest hit from the current economic crisis. And we know that women do the bulk of caregiving in families. And so as school closures and childcare closures continue or go to staggered school schedules, there have been a lot of projections that women's labor force participation will be impacted and that women will potentially scale back hours. I think the point that I would make, CLASP as an anti-poverty organization working on these issues, is that when we look at the low-wage workforce, women comprise about 2/3 of that sector, and we know that there will be many women who will just not have the choice to scale back hours, and they will need to return to jobs or to look for work when it's safe to do so. So I think the impact of that is on both children and parents. Parents do their absolute best, but when they have to go to work and need to bring income to their families, they are forced to make some very difficult choices, and that can include ending with their children in unsafe or lower quality settings, often unstable childcare settings, which can also make their employment unstable because we know that there's a relationship there. So,
and I'm sorry, but I know my time has expired. Can you just say, like, in one sentence, what do we need to do going forward? Is there some other model that we need to change, or do we just need
Absolutely.
resources?
We need public investment that fundamentally changes the structure of childcare. If we think about K-12 schools, while they will be hit by budget impacts, we're not questioning whether they will exist when it's safe to return. So we need public investment that supports childcare as a public good and relieves parents from the cost burden and makes sure that providers are not earning poverty wages.
Thank you so much. I yield back, Mr. Chairman. Thank you. Thank you so much.
Thank you. We have Underwood, Jayapala, and Macbeth, beginning with Ms. Underwood.
Thank you, Mr. Chairman, and thank you to our panelists, Ms. Matthews and Ms. Della Rosa. Last week, the Illinois Governor's Office briefed my office on the great strain that the child care sector is under and the work that has to be done to prevent its collapse. To minimize infection risks, Illinois providers are limiting the number of children in each classroom. The CDC has also issued guidance that providers should monitor children and staff for COVID-19 symptoms. Can you tell us how those necessary additional healthcare monitoring activities will affect families' child care costs? This is for Ms. Matthews.
Sure. So yes, all of these recommendations being put in place in states will require higher operating costs. It will cost more per child to care for these children. And this is really important for children's safety and for childcare workers' safety. But the childcare business model doesn't support having care cost more than it does now. Parents are already paying more than they can afford. And particularly when we look at having smaller classrooms and small group sizes, limiting the number of children and adults in a room, that means that many childcare programs will have to operate below their enrollment capacity. And that's just not sustainable without public funding.
Right, but the monitoring the staff and the children's symptoms, can you talk about how that adds to cost?
So we don't have an exact amount of what that would look like. We have done some estimates that look at anything between 19 to 24% an increase in per child costs, just in terms of purchasing the equipment to do temperature checks, to have more staff on duty to be able to do screenings when children, parents, and staff come in the door. So I think these are pretty significant costs.
Thank you. To Ms. Della Rosa, as Illinois enters the next phase of opening up our economy, thousands of childcare providers are being asked to reopen to support families so they can go back to work. However, for safety reasons, providers must continue to operate at significantly reduced capacity. How have the smaller class sizes affected your operations and ability to pay your staff? And how would additional federal support impact your ability to keep your staff on the payroll and provide care for the children of working families? Thank you.
Yes. So for us, for example, to give you kind of a real life example, we are licensed for 14 children. We're asked to reduce to 10. So that's 4 less children, 4 less parent fees that we are able to collect. And operating at a already very razor thin budget, that's a huge impact. And just as Ms. Matthews stated, we also would have to add another teacher to make sure that that teacher is up front, making sure they wash their hands before they come in, taking temperature. We have a whole survey that we have to now ask parents before coming in on a daily. And like she stated as well, having like outdoor sinks and completely remodifying our facilities will be a huge toll on our budget. So any kind of federal support will help us bridge the gap between what we're losing and what we now have to provide.
Thank you so much. I yield back. Mr. Scott, you're muted.
Thank you. Next, we have Jayapala Macbeth and Wild. Ms. Jayapala.
Thank you so much, Mr. Chairman, and thank you to both of you for being here today. I think the pandemic has just been such a stark reminder of the essential role that childcare plays in every aspect of our lives, unfortunately, too often invisible. And I think this has also been a reminder of the very thin margins that providers operate on due to decades of underfunding by both federal and state governments. I represent the Seattle area and one child care center in Seattle that's been serving our community since 1963 shared last week that this is the first time they've really been at real risk of closure. So let me start. I have two questions. Let me start with the question of what we need to do at a time when many parents are worried about the health risks of sending their child to a care center, and also the issues of being able to recruit high quality workers, which means paying them a living wage with benefits and collective bargaining rights. Ms. De La Rosa, what else is needed to make sure that childcare providers such as yourself feel safe at work, particularly during the pandemic?
Yes, so we're not seen as frontline, employees and essential workers. So when we're approaching vendors for things like protective gear, PPE, we're not getting any. So we've had difficulty even finding gloves with the amount of gloves that we actually use in the childcare facility, masks, aprons, anything really to show the parents that we are protected and we are using safe measures has been really difficult. Like I mentioned before, we actually have to modify our facilities. So having access to maybe an outdoor hand washing station, anything to really show parents that we are being safe and we are getting the federal support that we need will make them feel safer in returning and hopefully returning.
Yeah, thank you. I think that you're highlighting that childcare workers are taking on a huge risk coming into work, and we're not yet compensating them for that risk. The average pay for childcare workers is $10.72 an hour, and nearly 40% of those essential workers are people of color, many of whom are women. Ms. Matthews, you spoke to the gender aspects of this issue, but what are the racial equity implications of failing to invest in affordable, high-quality childcare, especially for nannies and in-home workers?
Sure, thank you for that question. So yes, I think, so we've talked about that women make up the overwhelming share of childcare workers. Those women are disproportionately women of color. And so we are seeing already the issues with the unemployment rate there that is impacting those providers. Going forward, I think there's, as you said, a need to pay providers commensurate with the important work that they are doing to make sure they have a living wage, that they have benefits. If we fail to do that, we will see increased economic hardship amongst those workers, but also there will be implications for parents. I think we talk about the childcare sector as a whole, but the reduction in childcare capacity will be uneven. And we know that it is communities of color, low-income communities that already lacked access to care, and it will be even harder to find in those communities going forward.
Thank you so much. I think that we in Washington State, 21% of our childcare workers have been furloughed and 23% have been laid off. And there are all kinds of challenges to get reinstated. And so we're working very hard to get workers back on payroll through things like my Paycheck Recovery Act and other means so that workers have security as they go forward. Thank you both. Chairman, I yield back.
Thank you. We have Macbeth, Wild, and Trone. Ms. Macbeth.
Thank you, Chairman, and thank you to our panelists, Ms. Matthews and Ms. De La Rosa. Thank you so much for joining us today. And it's so important that we examine ways to be able to save our keep our children safe, and also to save our child care industry and protect it from the most devastating impacts of COVID-19. As many states like my own here in Georgia, I represent Georgia, we're beginning to reopen. And I don't need to tell everybody about what's been happening here in Georgia. But we'll be faced with establishing new ways of socializing, educating, and taking care of one another. And that specifically speaks to our children. The effects of this pandemic will be long lasting, and we've got to really act now to be able to be prepared for them. This question is for both of you ladies. You mentioned that our child care system is struggling, and it was struggling even before the pandemic. And Ms. De La Rosa, we know that child care providers made an average of $10.72 an hour in 2017. Has the pandemic exacerbated the challenges that the sector was facing before? And if so, how and what can we do to ensure that we're better prepared in case something like this happens again in the future?
I can start, Ms. Matthews, if that's okay. So yes, being an early childhood educator in general is extremely difficult. I run a program, and I'll be honest with you guys, on average, I make about $15 an hour, and I work maybe 60, 70 hours a week. So we definitely, even before the pandemic, we definitely need some federal support. And being in LA, I'm able to pay my teachers a little bit more than $10.72 an hour, but it's not enough. If you are single and you're renting an apartment in LA, it's not enough for teachers to live off of. They're not livable wages at all. So again, like Ms. Matthews mentioned, any kind of federal support going forward would be amazing for our field. Now that we're closed and we have low enrollment, and parents feeling scared to come back, teachers feeling scared to come back, again, any kind of federal support to help us bridge the gap would be amazing.
Did you want to answer?
Sorry, I was just trying to unmute. So yes, absolutely. I mean, as we've talked about, the supply of care was already limited in communities with low incomes and communities of color. I think I would also point out that when children are not in childcare, many children are losing out on other vital services. So we think about the inequities here for children who really were getting meals in childcare through the Child and Adult Care Food Program, children who may have been getting early intervention services. All of those, the lack of services are going to exacerbate the existing inequities that we had. And I know we've talked that this committee has looked at the importance of high quality early childhood experiences for children. When children with low incomes won't have access to the kind of caregiving that my co-panelist is providing to kids, children will lose out. So yes, there are huge inequities that will only be exacerbated.
Thank you both, and I yield back.
Thank you so much.
Thank you. Now we have Wild, Trone, Adams, Levin, Sablon, Takano, and Stevens. If there are other members who are present that haven't been recorded, please note in the chat box. We begin with Ms. Wild.
Thank you, Mr. Chairman, and thank you for convening this incredibly important hearing. I'm happy to see both of the witnesses here, and thank you for the valuable information. My first question is for Ms. Matthews. I'm very glad that Congress made an initial investment in child care spending when we passed the CARES Act, which of course appropriated $3.5 billion in supplemental funding for the child care industry. My home state of Pennsylvania has received $106 million to meet child care needs, but we know that this funding is not enough. What we know is that in Pennsylvania alone, more than 190,000 licensed child care slots could disappear. This represents half of Pennsylvania's total licensed child care slots. So I've been talking with leaders in the child care industry in my district, and they've just emphasized over and over again that they need additional investments in childcare for it to remain available for essential workers and for childcare to be available for families when it's safe for parents to return to work and jumpstart economy. I'd like to ask, because I think it's already been asked, what additional expenses childcare centers are facing. And I think we've got a pretty good handle on that. But what I'd like to know from you is, could you discuss the benefits that children receive from attending a high quality childcare center? We know it provides stability. We know it provides support for their health, well-being, and development. Could you elaborate on the benefits to the children?
Absolutely, sure. So, and thank you for asking about the children, because I think, this is an issue that impacts parents, it impacts workers, and it impacts children. We have decades of research about the benefits of high quality, stable childcare for children. For young children, it supports their entry into school. It improves their educational outcomes and some employment outcomes, even into adulthood. So this is a critical support for kids. As I mentioned in the last question, I think, the instability of, first of all, kids are losing out on those educational enriching experiences, but they're also losing out from just the instability of not having those settings, those teachers who they had relationships with, not getting food and other supports. So getting children back to care safely and being able to provide those opportunities is critically important and will take resources.
I agree with you. I think one of the things we often miss when talking about reopening our economy is how vital it is going to be for children to have a place to go if their parents are to go to work. And that seems to often be missing from the dialogue. I have a question for Ms. De La Rosa. We know that the COVID-19 pandemic is placing a lot of strain on families, including stress about health issues, financial needs, the potential loss of loved ones. I'm very concerned about the impact on people's mental health, including frontline workers like childcare providers and children who are experiencing more stress during this time. Can you address, please, how the early childhood educators that you work with are coping with the stress of continuing to provide care during COVID?
Yes, so we thank you so much for that question. It's so important definitely for our mental health. We actually have tried to go a little bit above and beyond. We have enlisted a few pro bono psychologists to host parent evenings and family nights to kind of address anything that's been going on individually in their families. We've also hosted teacher nights as well, and we work with a local counseling center here in Westchester. And we've provided resource lists and different free resources so that they can reach out, teachers can reach out to make sure that they are taking care of their mental health. I personally have been making sure I'm emailing my teachers and talking to my teachers, whether it be via Zoom or through phone calls. And I've been emailing families and talking to families, making sure that we establish routines at home, making sure some of my families do receive subsidy, and we were their food resource. So I'm making sure that they have food. I've had to drop off food to some of our families. I've had to drop off materials. Some of them don't have basic materials like crayons or markers or anything to continue any kind of learning at home. We have done really fun Zoom calls, and we have done, YouTube story times with Teacher Mary and things like that to make sure we still have a sense of community with our families. Thank
you for that. With that, I yield back.
Thank you. Note that Kim Schreier is also present. We'll call next on Mr. Trone.
Thank you, Chairman Scott, for holding this. We really appreciate it. Mental health is absolutely just the most crucial issue that's coming out of COVID now. So to build on Congresswoman Wild's comments, which is where I was focused, is the children, the increased stress. This is for Mrs. De La Rosa. Children increased stress, the isolation. You mentioned the lack of routines in the pandemic. I mean, this really is hitting at their mental health. We've heard a lot of reports in the district on behavioral health among children at home. When the centers reopen, how can child care providers help these kids cope with these challenges, and what resources do you need that we should be trying to help with?
Yes, thank you so much for that question. That's something we have thought about tremendously. And as we welcome children back, and hopefully we will continue to maintain communication with them, and we get to see them, whether it be via Zoom or whatever we're doing to connect with our community. And we have not lost touch with any of our families. So as we welcome them back, we hope that we can do it gradually. Resources that can definitely help us. Well, definitely lower ratios and being able to sustain our teachers so that we can be there to comfort the children as they come back. Being home now for so long, it will be definitely a transition for them to come back. Resources as far as any parenting experts and psychologists and anything we can make available to the families so that they have additional resources in coming back, and any challenges maybe that are more private in home would be wonderful.
Mrs. Matthews, in the past few months with the shelter-in-place orders, many of the kids have not been able to interact with other children other than siblings. How do you think that is going to negatively affect their social development, and what can child care facilities do to help them develop those children's social skills?
Thank you for asking that question. I think there are going to be an enormous number of needs among children when they return to childcare settings. You just heard my co-panelist talk about how she's been trying to address that in the interim. When children return, there will be the need to support their mental health. That means helping providers think about their curriculum and the enriching activities, how to support that. But there's also, in addition to missing out on the interactions with peers and certainly needing support, when we look at some of the data on the growing hardship among families, we're seeing increased food insecurity, hardship, even in households with very young children. So I think you've underscored the valuable role that childcare plays. It's not just about keeping kids safe and letting parents go to work. Childcare providers support all of this, and they help families meet all of those needs. So I think, again, the reason for the need for investing in childcare is to be able to make sure that providers have access to that full range of resources to support families.
Thank you. I yield back.
Good, thank you. Dr. Adams.
Thank you, Mr. Chairman, for convening the virtual briefing today, and thank you to our witnesses for sharing your knowledge and expertise. I do want to ask about an issue that our child care workers dealt with before we even knew of COVID-19, and it's been talked about already, but that's the stubbornly low wages that our child care workers earn. I've been working for probably 30 years or more trying to get a living wage, even here in North Carolina. On average, as you've heard, $10.72 an hour as of 2017. But we estimate, HHS estimates that an affordable child care program should cost no more than 10% of a family's income. But based on the average price of a child care program, and a worker making a measly $10.72 an hour, instead they spend about a third of their income on child care. So, Ms. Matthews, can you touch upon what other policies Congress can promote to ease the burden on child care providers, allowing them to continue to provide high quality care, while also allowing them to pay their staff a living wage?
Yes. So there, as you say, childcare providers are undervalued. They are undercompensated. I would add that in addition to low wages, many do not have paid sick days or paid leave. So all of those benefits we need to build into our childcare system. And this really makes the case for public investment. Families cannot pay more. You just, gave the statistics that childcare is an inordinate amount of a family household budget. So when parents can't pay more, we do need the public government to step in, and we need to invest in a childcare system that pays providers a living wage, that takes the relief off of families on the cost burden, and makes sure that access to quality childcare is available for all families.
Great, thank you, Ms. De La Rosa. And you have a center. Can you give some insights into what passage of those policies would mean practically for your enterprise, particularly during this pandemic?
Yes, thank you. Running a center, after you're done doing payroll, and again, on average, my teachers get paid about $15 an hour, you have nothing left. And to maintain a high quality program, and we're constantly making sure we introduce the most developmentally appropriate materials. We also conduct teacher trainings. And we provide food, we provide breakfast, lunch, and snacks for our children, so parents don't have to do any of that, and that's all included in the cost. We have enrichment programs. We have yoga and soccer, and everything to make sure we're giving our children a whole education. After all that's said and done, our budget is usually in the negative. So federal support is definitely crucial in maintaining a high quality childcare program, especially now during this pandemic.
Yeah, I'm curious about how you're going to do, or if you talked about the social distancing, especially with young kids. I know I'm out of time, but I'm just curious about that, and I'm gonna just yield back, Mr. Chairman, because I know there's some others want to speak.
Thank you, and we're going to run out of time. Mr. Levin.
Hey, Mr. Chairman, thank you so much for convening us today and for all your great leadership. As I've been listening to this conversation, I'm just coming at this as a dad of 4 kids who's used every kind of child care, from in-home providers to co-op nursery schools to everything else. Let's stick with wages and the living that somebody can earn working in this industry. Ms. Matthews, what do you think if Congress could adopt and the president would sign our Raise the Wage Act that would give $15 an hour across the board as a national minimum? What effect would that have on this industry? Do you think?
That would have a significant impact on the industry. The majority of childcare providers earn under the federal poverty level for a family of 3. So yes, increasing the minimum wage, and I would add, along with paid benefits that workers need, that would be a tremendous impact on the childcare industry in a positive way.
Thank you. And so things like paid sick leave, and when you're thinking about benefits, tell us what you're thinking about.
Right. So, it's extraordinary that even before the pandemic, certainly the pandemic has shown a light on the need for paid sick days. It's clearly important for people not to come to work sick, but it's extraordinary that many childcare workers lack those benefits even before the pandemic. We want to prevent illness in early childhood settings. As those of us that are parents know how quickly those spread and children get sick easily. So making sure that going forward in an ongoing way that workers have access to these benefits is important for everyone's health and safety, as well as their own caregiving needs.
Thank you. All right, Ms. De La Rosa, you mentioned that you had applied for PPP and hadn't gotten it yet. I just wanted to give you an opportunity to expand on that. Could you tell us your experience, and do you have hopes of getting it? Have you been approved by a bank or credit union, and the money hasn't come? Tell us where you're at with it and why that's been so extraordinarily difficult for you. It seems like you deserve it as much as anybody else, if not more.
Yes, thank you. Yeah, I would agree. We definitely do deserve it. We applied for the PPP back in March, right when we closed. We knew. We applied for it. First, we were told, and we applied through a bank that we already have established relationship with. We've gotten loans through this bank, previous loans. We have our business account through them. So we applied back in March. First, we were told they ran out of funding, but that they would hold our application. And then when more funding was released into the program, we now have been told since April that we're just pending. And so I honestly don't have hope that we will receive any PPP. And if we did, to be honest, it's not enough. It won't be enough for us to sustain and retain our teachers and be able to open back up and really bridge the gap for our funding.
Thanks, Mr. Chairman. I'll just note that that's obviously not how we hoped PPP would work, and let me yield back so others can have a chance. Thanks so much.
Thank you. We have 10 more minutes and 4 more to ask questions. I'm going to ask the 4 people, Sablan, Takano, Stevens, and Schreier, to all ask their questions now, and for our witnesses to respond to all 4, starting with Sablan. If you could make them concise, we can get all the questions in and hopefully all the answers in.
Yeah, thank you, Mr. Chairman, for holding this. Ms. Matthews, can you tell us in a very short way how are grantees using the supplemental CCDBG funding that, and what are the most effective use of the funds, and how long do you expect those funds to last?
Okay, if you could record the questions so we can give the answers at the end. Is that your question, Mr. Sablan?
Yes, thank you.
Okay. Mr. Takano.
Thank you, Mr. Chairman. Ms. Matthews, in the previous coronavirus relief packages, we provided some flexibilities in the use of Child Care Development Block Grant, the CCDBG funding. We have been hearing from advocates that states and providers need flexible resources. Can you explain how we can make programs like CCDBG and other essential child care programs more flexible to meet the needs of providers? Thank you.
Thank you. And meanwhile, I want to note that Ms. Shalala and Mr. Norcross are also on the in the meeting. Ms. Stevens. Stevens. Ms. Schreier.
Hello, and thank you so much for this meeting. My question is, as a pediatrician, I am of course worried about childhood development and nutrition and all of the things that you provide. I'm also concerned when I see the disproportionate effect of COVID-19 on communities of color, and that it is really many of those families who will be putting their children back in childcare first. I also know as a pediatrician that kids will not necessarily show symptoms, but they transmit germs very easily. What have we learned from other countries in terms of how to keep children and families safe when resuming daycare, childcare?
Okay, and our last question will be from Ms. Stevens. If you're on a phone, *6 will get you off of mute. Ms. Stevens, she was with us earlier.
Mr. Scott, Ms. Hayes was also on the list.
John Hayes, are you still on the line? Ms. Hayes or Ms. Stevens?
Hi, I'm here.
Okay.
Hi, Mr. Chairman. And thanks to our panelists, and thanks for this great briefing. Just as a supplement and as a reminder, earlier this month, the Bureau of Labor Statistics reported that 1/3 of child care providers lost their jobs over the course of the month of March alone. And that's obviously got a huge impact for every single one of these individuals. It's about 300,000 child care providers. And I wanted to talk about or just have Ms. De La Rosa maybe, in the aftermath of this, just kind of chime in about this experience for her program and what the toll of job loss looks like, and just continue to highlight job losses and all the other points that have made. I really just could not think of a more pertinent topic for us, Mr. Chairman, given the need that Ms. Wild discussed of people who are going to go back to work and need to have child care. I'd also be very interested in the impacts on minority communities, and in particular, women of color. There's been several reports of firsthand stories of people who have frankly had to quit their jobs because of lack of childcare availability, particularly for children with disabilities. Thank you. Thanks, Mr. Chairman.
Our last question before we get to responses is Ms. Hayes.
Hello, I'm sorry, I dropped the call.
Okay, you're on.
Actually, my question, because I know we're at the end of time, was basically what Haley just asked. I've been talking with providers in my district, and while they're talking about paying the bills and paying their teachers, the number one issue is opening safely. And I know that our minority communities and some of these families are already in childcare deserts. So if you can you speak to what communities and what families would be hit hardest by these providers closing? And what can we expect for in the means of childcare deserts? I mean, this is an issue that has been very important to me. Actually, I've been working with the chair for quite some time now, and we have a piece of legislation that hopefully will be ready to go tomorrow that will address some of the issues that we've heard today. But my question is just specifically, can you talk about those targeted communities and what these childcare deserts will look like moving forward?
Thank you. Ms. De La Rosa, you want to start off?
Sure. Thank you so much for your questions. I want to address children's safety first, because that is something that we have lost sleep over. So that's something we are definitely concerned about. But some of the things we have seen, and based on CDC requirements, that would work for us is introducing more outdoor time and having an outdoor classroom area. That way we can social distance, and, being that the virus doesn't, there's still a lot we don't know about this virus, or we can transmit the virus. So that's one of the things we would like to incorporate, and that's a lot of the programs around in my community would like to incorporate, is having more of an outdoor classroom. And again, daily check-ins, strict sick policy. We're also weighing the pros and cons of what's developmentally appropriate, what we can do to support their social emotional. Children 2 and 3 years old are just not going to social distance, and denying them a hug or denying them any comfort as a teacher, we cannot do. So we will definitely still be giving them comfort, but things like wearing an apron and being able to change it out constantly, or wearing gloves and being able to change it out, will hopefully reduce the risk. And then as far as job loss goes, we've been hit hard. I am part of a cohort of directors here in Westchester, and most of them, the ones that are open, are operating at 25% enrollment, and all the programs around here have had to furlough teachers. We want to come back to work. We are here to serve the community. We get in this field for a reason. So we want to be here to serve the community. As soon as we're able to do so safely, and as soon as we get the federal support to do so, we will come back to work.
Ms. Matthews?
Okay, I know we're almost out of time, so I'll quickly answer the questions related to CCDBG and the childcare desert. So yes, the CCDBG dollars and CARES Act have been really important in states. They have provided grants to providers that had to close to be able to continue paying their staff. They have subsidized the care for essential workers who needed childcare, as we've talked about, at higher operating costs. They've provided cleaning supplies, incentive pay to providers who are working during this challenging time, and also covered parent fees and tuition so that families didn't have to have the cost burden of childcare at this time. So those have been very important. I will say there is a lot of flexibility in the childcare block grant as it exists, and the Office of Childcare has worked with states to understand how they can adapt their policies to be able to meet the crisis, in particular, making sure that they are putting in place the essential childcare and making that available to families. On the question of childcare deserts, I'll just say very quickly that absolutely, without further public investment, I think we can expect an erosion of licensed childcare capacity across the board. And that means that in those areas that were childcare deserts, there will be even less supply. And I think all of the data that we've talked about today in terms of the communities that are being hardest hit by the pandemic because of historic and systemic inequities, the same will be true for childcare supply. And so we can expect that the impacts and the reduced childcare capacity will be the hardest hit will be communities with low incomes and communities of color.
Well, I want to thank both of our witnesses for this testimony. We know we have a very difficult situation. We know childcare will always be expensive because of the low child to teacher ratio. Each parent has to pay either 1/4 or 1/6, depending on the ratio of the teacher salary, plus all the other expenses. And so it's always going to be tight. The parents can't afford it, and the workers need to be paid more, and that's always going to be a challenge. And so without some federal support, it's going to be very unlikely that we're going to be able to get through this. And that's why this legislation is so important. So I want to thank Ms. Matthews and Ms. De La Rosa for being with us today, and all of the members for their participation. With that, if there's anything else to come before the committee? If not, thank you very much, and this concludes the briefing.
Thank you very much.
Thank you. Thank you very much.